Hello, my name is Bonnie Cavanaugh, a registered nurse here at St. Mary's Medical Center. I am the Orthopedic Clinical Coordinator. In my role, I get to help prepare you for your upcoming surgery. When doing this video, I started thinking about all the people in my life who have had total joint replacement surgery. I think about my neighbors, my Uncle Bill, my husband's mom, and also some members of our community that go to my son's school. And in that spirit, we want to make sure that I get the information out that I share with them. First, you will be coming to St. Mary's Medical Center on the pre-admission visit day. At this visit, which will take place within 7 days of the surgery, you will be asked to bring with you some of your medication lists that have all the information of your herbs and medication. We want to know how you take that medication, we want to know the route, and we want to know how often you take that medication. Also at this visit, you will have a chest x-ray. You will have an EKG, which is a heart test. It's called an electrocardiogram. We look forward to meeting you at this visit and planning your individual care for your upcoming surgery. In the joint replacement process, you're going to be asked to do many different things. We will ultimately be caring for you, but some of the things you will have to do on your own. One is you will need to go and have a visit with your primary care physician. With that information, they will be sending it over to St. Mary's and letting us know that you are prepared and ready and safe to have general anesthesia or epidural anesthesia. Also, you may be asked to be giving blood for the upcoming surgery. If you are asked to donate blood, your surgeon's office will let you know. Not everyone needs to give blood. This must be done within 2 weeks of surgery, and the surgeon's office will discuss that with you. Also, we would like you to know that you must stop certain medications. Those medications include any medicine that will cause you to have increased bleeding time before the surgery. Those include aspirin products, non-steroidal anti-inflammatory medications, and any blood-thinning product like Coumadin or heparin. If you are taking a medication called Celebrex, we will be asking you to stop that within 7 days of your surgery. Certain herbs or vitamins can increase bleeding time. Those can include vitamin E, garlic, and ginkgo biloba. If you drink alcohol, please decrease the amount. Talk to your surgeon about how much you are taking in. Alcohol can increase your bleeding time. We also want to make sure that you're drinking a lot of fluids. Drink water and non-caffeinated beverages. Home preparation means we would like you to have your home as safe as possible. One of the things you can do is to make sure that all entryways and hallways are clear of pet toys, children toys, magazines, extension cords, or throw rugs. So please look at your home and see, is my home actually safe? Another thing to keep in mind is who will be helping you with grocery shopping. After surgery, you will not be allowed to drive for a minimum of 3 to 4 weeks and often 6 weeks if you are taking narcotic medication. So please look around your home and see, what can I do to make my home safer? We have sent out a booklet that you have received from your doctor's office that has some home safety in mind. While staying at St. Mary's Medical Center, you will have a private room. We believe that it's nice for people to get some sleep if they can and have a private spot. Also, you will be meeting the members of the healthcare team in your room in a private setting. The physical therapist will be working with you on exercises and range of motion, how to get around. The occupational therapist will be working with you on activities of daily living. That will include toileting, getting around your kitchen, showering, and other modalities, including dressing. You will have a nursing staff, which will include 3 nurses every day in a 24-hour period. The anesthesiologist that you will be meeting will meet you before your surgery, and that will be in the holding area or the pre-surgical suite. When you meet your anesthesiologist, you will be discussing with him or her the type of anesthesia you will receive. That will either be general anesthesia or spinal anesthesia. If you have a nerve block, the doctor will be talking to you about how to best alleviate the pain before and after your surgery. Okay. The surgical process will be explained in detail by your surgeon. All of you will have internal sutures that will be absorbable and that you will never see. At the skin level, you will probably have about a 4 to 6 inch incision. You will either have steri-strips or sutures. The steri-strips will automatically fall off and peel away mostly before you even leave the hospital. The staples will be removed once you go home, and your surgeon will let you know when that will be. At the hospital, after surgery, when you wake up, you will have many different tubes. I want to go through some of the definitions and what you can expect. An IV is an intravenous line. It will be put into your arm by the anesthesiologist before your surgery. When you see the anesthesiologist put the needle in, you don't see him remove it. There is no needle in your arm. It's a silicone catheter that's flexible and bendable so that you can move your arm. In addition to that, you may or may not have a PCA, patient-controlled analgesia. The nurse will teach you how to use this, and it will administer your medication after surgery. You will have a hemovac drain. The drain leads into your incision and will be removed at day 2 after surgery. The purpose of the hemovac drain is to pull fluids from the incision so you don't have an infection. You will all have a Foley catheter inserted into your bladder before surgery. We try to remove this within 24 hours after surgery, or as soon as you're able to get up out of bed. In addition to all of these tubes, you will have what are called thromboembolic devices, or TED stockings. They are thick white stockings that we put on before your surgery. They will be very helpful in preventing clotting and inflammation. The nurses and the therapists will teach you how to put those on and remove them. You may also be wearing sequential compression boots that will help prevent clotting while you're in bed. You will also have an incentive spirometer. The incentive spirometer will be given to you pre-operatively by the nurse, and she will be teaching you how to use it. The purpose of an incentive spirometer is to breathe deeply and release. We want to get the anesthesia out of your lungs, and we would like to prevent pneumonia. If you're having total knee replacement, you will have a continuous passive range of motion machine. That will be used to get your knee moving while you're awake. After surgery, you will be asked to take an antibiotic every time you go to the dentist or for a dental cleaning. Your surgeon's office will provide you with a prescription for that medication. After surgery, we want to make sure that you're drinking plenty of fluids, eating lots of fruit and vegetables which have fiber, and we will be giving you a stool softener. And we want to make sure that you're getting up out of bed, again, to prevent pneumonia, blood clots, and also constipation. We want you to call the surgeon and report any symptoms of blood clot or wound infection. Blood clot may include pain in the back of the leg that has had surgery or in the other leg. In addition to pain, it may feel red or warm to the touch. If there's any indication that you may be having a blood clot, please call your surgeon's office right away. Or if you're having difficulty breathing, call 911 immediately. The signs of a wound infection are redness, tenderness, drainage, increased swelling, or increased fever or temperature. If you have any of those signs, please call your surgeon's office immediately. We want to make sure that you are receiving adequate amounts of pain medicine. So please talk to your surgeon, talk to your nurse, and talk to your therapist. We know education is an important aspect of your care. We plan to keep you involved throughout this process, as this is just a start to your upcoming surgery.